Hey guys, so today I'm going to talk to you about what sciatica is. So sciatica is the umbrella term that we use to describe pathologies relating to the sciatic nerve. The sciatic nerve is the longest nerve in your body, and it goes from your spinal cord and branches out into smaller nerves, which innervate all the way down your leg to the base of your foot. Symptoms that you may experience if you have sciatica include severe one leg pain, radiating pain down the back of one leg, or numbness and tingles. It's caused by either compression or inflammation of the sciatic nerve, and a thorough assessment by your physiotherapist will be able to help you determine what to do in the acute stages and moving forward. But you can head to our website to read the blog in full. During the acute stage, your sciatic related pain will likely be highly irritable. Depending on the structures that are causing your pain, your physio might provide you with a few gentle exercises that you can do at home. It's important to know what movements relieve your pain, and this will be guided by your physio. So the first exercise that your physio may recommend is knee to chest. So for this, you're going to lie on your back on the floor or on a mat. You're going to bring one knee up towards your chest and then bring the other, just hugging towards into it. Another exercise your physio may recommend is something we call a McKenzies Extension. So for this, you're going to be lying on your stomach. You're going to be lying flat, palms are going to be around head height and forearms resting on the ground. For this, we're just going to gently press up until you are resting on your forearms and getting a slight stretch in the lower back. Gently lowering back down and repeating that movement. Your physio may tell you to progress this exercise, in which you will come up onto your hands, so pressing through the forearms up onto your hands for a greater stretch. And same thing, slowly lowering back down and repeating the movement. Once the acute stage is settled, you'll be in the subacute phase, in which you'll be able to perform some more active movements. During this time, mechanosensitivity starts to play a role. Mechanosensitivity is your body's reaction to mechanical stress, and it's a protective response which causes a bit of neural related pain with movements. To de-stress the nerves and allow movements to be performed without this pain, we start to perform something called neural glides, and your physio can guide you through this. Neural glides are when you perform a movement that helps the nerve glide along the surrounding tissues, helping reduce some of the sensitivity that you might be experiencing. Your physio might provide you with a few different sciatic nerve neural glides that you can perform. So the first one, we're going to be lying on our back. You're going to be holding behind your knee. One knee is going to be bent. I'm just going to move through up and down. Foot's just in a relaxed position. To progress this, then we start adding in the ankle. Should feel a little bit down the back of the leg with this one. And to increase this, leg stays straight, and then adjust the foot moves. So toes come towards you and then pointing your foot. So you're going to be sitting, feet are on the ground, you're going to come into a slightly slumped position, so poor posture. One leg's going to come out straight in front of you. If you bring your toes towards your nose, you might feel a bit of a stretch down the back of your leg. At this point, then we're going to go up with our head to the roof, so chin is coming up to the roof. As we bring our chin to our chest, our toe is going to point. We're just going to move through this a few times. You may feel a bit of a stretch or sensitivity down the back of your leg, but by lifting your chin to the roof and then pointing your toe when your chin is tucked, it's helping glide that sciatic nerve and the surrounding branches through the tissues, and it's going to help reduce sensitivity. You can repeat this on the other side.